Thank you. Good morning, and thank you, Liverpool, for laying on your very, very best weather. I live in London, but my son came to university here, my youngest son, and actually I felt a huge nostalgia coming up again last night, and it is a wonderful city, and you are doing some incredible work around mental health. So can I please thank you for hosting this important event. I am still a registered mental health nurse, and it dawned on me last October that it had been 40 years. And I don't know where those years went. You're all meant to have just gasped that I couldn't be old enough. So I'm marking you down already, hostile audience. But I've spent a lot of those 40 years furious, and I seem to get crosser as I get older, about some of the inequalities in mental health, whether that's in funding or how society looks at it. I do think we've made huge advances, and I do want to thank the Prince of Wales. I met him actually when I got my CBE. You never know who's going to give you your gong until the day, and he gave me mine. Now, my husband insists that when the ceremony was ongoing, I wouldn't let go of his hand and had to be prized off. Actually, the truth is he wouldn't let go of mine and an A because he wanted to talk about mental health, even in the middle of this very formal ceremony. So he really means this. I think we've come a long way in this country because of people like Prince William, some of our footballers, boxers, the stigma around mental health, around speaking up, I think is beginning to be challenged. But I think, and I'll say something about this at the end of my talk, I think we still have a very long way to go in certain communities and certain parts of our country, a very long way still to go. So we should never be complacent. My job nationally is really, as NHS England, to work with the Department of Health and Social Care, to work with OHID, which is like our public health and prevention department nationally, and of course other cross-government agencies. But essentially for the NHS, to specifically look at what treatment, assessment and treatment services we will be making available to people across the country. I have a pot of money. We're just in the 6th year of our 5-year plan, current 5-year plan. I know I'm considering it year 0 of the next 5-year plan. I have to be very careful what I say now because obviously we're in a pre-election period in this country, in case you hadn't noticed. So I've been given all sorts of warnings about not being political. I nearly wasn't allowed to come and speak today because I love to be political, but I'm going to be on my best behaviour. The point is, I'm going to talk to you about some of our 5-year plan and what we've done, and I'm going to talk to you a little bit about my hopes for the future and what we ought to be doing next. Our 5-year plan entailed 2.3 billion ring-fence money over 5 years, and it was my job to make sure that we targeted that nationally to the most important areas that could make a difference. We have a treatment gap in this country. If you look at some of the different disorders or problems, it varies, but across all ages and all specialities, the treatment gap is a reality. I think making services accessible for all when they need them and bringing the waiting list down are absolutely essential part of suicide prevention, actually. So a lot of what we've done with that 2.3 billion is targeted on, and I'm going to say a little bit about some of the areas that we've targeted it in around suicide prevention, but target it to the areas in greatest need, the specialities in greatest need. So we've been doing that. I do know, and we monitor it very carefully nationally, I feel like every penny of it is mine, and personally mine. And I work with chief executives such as Joe, but others across the country to make sure that each year they're getting their share of that money, that they can see it, that they can attest it's real. Some of the indicators that would let me know that we're having impact is we are seeing way more than a million additional people every year in mental health services since the introduction of the plan, and we are employing 40,000 more mental health staff across the country than we were at the beginning of the plan. So workforce is critically important. Now let me see, does this work? Yeah. The ring fence, I would just say that the ring fence on that money, mental health money, is absolutely critical because the whole NHS system is under pressure in this country and in every developing country. We know that demand and need is outstripping supply of both finance and workforce, for example. So ring fencing the mental health money now and over the next 5 years and the 5 years after that is going to be critical. I've just put this up here because you can see since 2011 that the rates of suicide are falling in this country. I'm not going to say too much about where we are now because I think our colleagues at NKish are doing a talk later today where they will say more. So you don't want to listen to the same thing twice. We think some of this is wider societal action, what's happening in economy. Interestingly, and this is a personal view, I'd love to know what you think in other countries, we were really worried about an increase in suicide rates potential during COVID. We were super worried and we had to try and innovate in all kinds of way to reach people where we were locked down in this country for a long time during that period. But interestingly, suicide rates did not rise during COVID. And there are theories that potentially, and researchers and people with bigger brains than mine will look at, is this so? But there is a theory that everybody felt in the same boat, that they felt more connected, albeit that it was really worrying times. People perhaps felt less isolated because we were all in this boat. But I don't know, I'm sure research over time will give us a view. But anyway, we can see that we've made some good progress in this country, but we're flatlining a bit now, and we must go further. I do just want to say that as a young nurse, I very much remember everything about a young woman that I was a primary nurse to who took her own life. I remember her face, I remember her name, I remember her mum. I remember the discussions we had, I remember how it felt. I could cry to this day. And I do need to just pay huge respects to our three dads walking. I know I gather two of whom are here today. And carers and families and professionals across the country who, like me, decades later, will remember how catastrophic it is. So although we've made progress, hurrah, fewer deaths by suicide than we had, we're bringing the rate down rather, we've a very long way to go. So what's some of what we've been doing with the 2.3 billion then? We work with NKish, who you'll hear from later, and they have done excellent work studying research every year, looking at suicides longitudinally and helping us understand what might have prevented them. Now, we do know that about 26% of people who take their own life are in touch with what we would consider to be specialist mental health services at any one time. It means, therefore, that many people either are not accessing specialist services who need them, and I've talked about what we need to do to close that treatment gap, keep ring-fencing the resource and driving a plan. But it does mean that GPs, primary care, colleagues in the workplace, family, schools, universities, others, are absolutely critical in working with us on suicide prevention, as we all know, because only a quarter of people are in touch with specialist mental health services. I would just say that one of the things that we have driven in our national programme in recent years has been, we think, the biggest planned state-funded talking therapies programme of possibly anywhere in the world, relevant to the size of our tiny country. I'm aware that Australia is bigger, but it's a huge expansion of talking therapies for common mental health problems. Anxiety and depression can be killers, and so I'm really proud that we've made huge progress in rolling that out. We see more than 1 million people a year in that programme. But we know that access to community mental health services, really excellent crisis services and 72-hour discharge follow-up is important. NKish has found that for people discharged from specialist mental health hospitals, it used to be that the first 7 days post-discharge were the most critical in terms of suicide. Over the years, they pulled that forward and said, no, it's the first 72 hours, actually. So we've had quite a programme of trying to ensure that at least 80% of people are followed up within 72 hours of leaving hospital. Not everyone will need that. Some people leave and go straight on holiday, for example, or, you know, go elsewhere with their families. At the minute, we're at, I'll say more about that in a minute. The other thing that NKish has found is that if you're cared for out of area, we've had such phenomenal pressures on our beds and our inpatient beds that many areas send patients in crisis to other parts of the country for inpatient care. This appalls me, actually, and you know, it's a matter of great regret to me that we have not yet resolved that issue. I do remember during COVID, as part of NHS England, the huge distress we all felt at people who needed intensive care for their physical health. And if we ran out of intensive care beds in one part of the country, there was mutual aid in another, and we would send the patients there. And although I admired how much this mattered to colleagues, I did sit there thinking in many meetings, yeah, but we do this to mental health patients all of the time. They're conscious, they understand what's happening, they need the hope of being close to family and friends, they need to be local, they need to be in sight and in mind and held always. NKish have found that there is a link between out of area. And that, of course, you do need bespoke suicide prevention and bereavement services. So what have we been doing in relation to some of those big findings that I've told you about just there? Well, $1 billion approximately of our additional $2.3 billion has gone into expanding and trying to transform our community mental health services. Now, the Life Rooms here in Liverpool are and what Merseycare have led, are a great example of that community expansion, because we might come up with these schemes nationally and put the money out there. Well, we do, and we're going to for the next 5 years as well. But services have to be brought to life locally. You have to work with local primary care, schools, education, employers, third sector organisations and social care. So that community transformation that we've been rolling out across the country over the last 5 years is a critically important part of suicide prevention and intervening earlier and differently. Let me just make sure. So I've talked about some of the psychological therapies that we've been rolling out. It's really important that our talking therapies programme, for example, which is globally leading, is properly embedded locally and is absolutely flexed to meet the needs of local people. And is there anything else I want to? Well, we're going to come on to the introduction of crisis services in the community. During COVID, because people were locked down, and we forget what life was like before the vaccine, actually, because it was very difficult for professionals to go into people's houses as they were locked down and go to house, particularly in the early months where we weren't sure if we were virus carriers, if we would kill people. So we set up at pace. In the matter of 5 weeks, actually, I wrote out to colleagues across the country and said, you know, over the next 5 years, we intended to set up 24/7 all-age NHS crisis lines. Could you do it now, please? And colleagues did. I mean, amazing, amazing. Of course, they had to refine those crisis lines. Of course, they needed to make sure that they were suitable or flex for deaf people, for example, or neurodiverse people who might prefer to have their crisis support online, via text, whatever. So we're still refining them, but we did. All parts of the country in the space of 5 weeks set those teams up. We've also currently, and we think we've just achieved it, so we're very proud, we've linked all of those NHS crisis lines to 111. It's 111 star 2, but they will hot patch you through. So you can be anywhere in the country. You can call 111 star 2. They'll hot patch you through to your local NHS crisis line. So these are things that are amazing. That's an innovation that's a few weeks old now, but we've achieved it. And psych liaison teams, we set out to put specialist psychiatric liaison teams or mental health liaison teams into every major A&E department in the country. And we've done that. And they're 24/7, and they're specialists in understanding self-harm, assessment of suicidality or other risk, and working with the physicians in our acute hospitals to try and promote optimum safety. So you can see we're making some progress there. We have absolutely written out and asked by the end of this month all 42, and I've got a little map of them at the end of this talk, all 42 of our ICBs. We do love to restructure in the NHS about every 7 years at least. Our latest framework and structure for delivering local healthcare are integrated care boards and integrated care systems. We've got 7 regions and 42 local systems. So we've written out and asked all of them to produce by the end of this month their plan for over a period of 3 years to localise care, to stop this awful warehousing and exporting often some of our most vulnerable to other parts of the country. What's your plan? Does it need capital? What's the workforce implication? How are you going to stop doing that? What are the specialist needs of those patients that you felt the need to send them out? Can you meet them locally? Can you get together with another ICB next door if it's highly specialist and make sure that between you can have services there? So we've done that. Enkish and indeed Simon Wesley, Professor Sir Simon Wesley, who was asked by Theresa May to come up with a new Mental Health Act, has absolutely called out the culture of care, particularly in inpatient settings. We feel that a lot more work needs to be done there. We've currently invested more than 42 million, something for each of the ICBs. Oh, red light. I'm about to get sent off for an early bath or a late bath. I'll be really quick to just get to the end of this. But basically, we've got a whole programme that all NHS providers are part of, that we've co-produced it with parents, with loved ones, with people with lived experience, and we're about to have a massive drive over the next 3 years at changing the culture of care in inpatient services, so people are less scared to ask for help next time they need it, that they feel that the inpatient care will be truly therapeutic and much more linked to the community, so there are much more seamless admission and discharge pathways, because we know that those transitions are risky. And I'm going to, because I'm scared of Claudia, I was told to be very scared of her. You can have these slides. I've got others. We do have a national suicide prevention strategy. This is my last slide, but those colours on the map are our 42 ICB or ICS footprints, and they show you what the rate of suicide is across the country, and the darker the colour, the higher the rate of suicide. I do just want to conclude by saying that the reason that local is so important, and hopefully we will get another 5 years funding, and we will be demanding in what we ask for by way of reducing waiting times, closing the treatment gap, expanding services. We're going to be demanding about that nationally. But I describe it as, it's my job to try and get some ingredients for a cake and to get government and others to ring fence and pay. It's the job of local services to make that cake and decide what's right for them. You know, rural and coastal areas where we know we have very high incidence of suicide. If you've got a high degree of, I know you talked about nurses yesterday, know where your occupations and suicide hotspots are, know who you're targeting. Don't just think that we're the NHS and people will come to us. Work with other agencies. There are some wonderful examples of those 40,000 extra staff that I talked about earlier, where we've implemented really great peer support roles, where you can take from a local community and train people up in their mother tongue, or, you know, who understand farming or who understand where the hotspots are in the city. Great work in London, for example, with the British Transport Police, the Samaritans and the NHS around some of the stations where people were taking their own lives, and prevention, huge impact. So whether you're working with the farming community, fishing community, we saw earlier that men are particularly a worry, or if you're looking at mental health support teams in schools, we've been busily rolling those out since 2019. It's pivotal that those we've covered, we will have covered 60% of the country by the end of this year. We need to see what a new government wants to do. They're all promising to put mental health support into schools, so let's see. But it seems to me pivotal that the younger generation are alive with opportunity in terms of both working in services, informing services, and that these mental health support teams in schools can change the language and the understanding of distress, can help neurodiverse youngsters, those who are dabbling with drugs, those who will be doing my job one day and your jobs maybe one day. It seems to me that only local areas can understand as we roll out a national programme like schools. They need to be flexing every sinew to work with local communities. I do just want to, my very last sentence will be, as Chief Exec of an NHS trust, my trust covers the Grenfell area, which I suspect people across the globe know about. It's the 7th anniversary of Grenfell. It's the tower block that went up and killed 72 people. And that's right in my patch. And we have learned so much from the Grenfell community about how not to be as the NHS, what local communities don't want as they think about distress, suicide and health and looking forward. And they've taught us a great deal. All of it is about working with people locally, listening to parents, listening to education, listening to each other. So, yeah, here's to the next 5 years and some more billions, please. Thank you. Thank you.